DynamX BioAdaptor on PPCI Singapore experience. Please.
Okay, thank you very much to Bonnie for your introduction. So I'm tasked this morning to share our experience of using DynamX BioAdaptor in primary PCI. So when we do primary PCI in STEMI, we know that implanting a DES is considered the standard of care, and by the ESC guidelines, it's a class 1A indication. We have many DES on our shelves, but is there any particular DES that make a difference for your STEMI patients? So I just want to share the BioSTEMI trial that was comparing these Osiro D-strut DES versus Xience that was done a few years ago. And what the BioSTEMI trial shows is that there are superior outcomes when you use Osiro versus Xience in the setting of primary PCI. And the difference was mainly driven by TLR. So you see that at 1 year, the TLR rate was 4% for Osiro and 6% for Xience. And the outcomes were sustainable at 2 years, again superior for the Osiro DES and versus the Xience DES. But what you can appreciate is that the event rates continue to climb for both DES. And so I think one thing that we have to be aware is when you implant a stent in a patient, some patients will continue to have stent-related adverse events at 2 to 3% each year. And one of the drawbacks of primary PCI is when you implant a stent, there's always a higher risk of stent thrombosis compared to the elective PCI. Even with a D-strut Osiro DES, it has stent thrombosis at 1.7% at 1 year and 2% at 2 years. So there is a need for a better stent platform in the STEMI setting. So I think Paul has told you about the unique features of the BioAdaptor implant. So basically, it is a BioAdaptor that has the strengths that will unlock at 6 months. So the unique feature of this adapter is that it behaves like a stent at 6 months, but after 6 months it unlocks itself. So literally, the artery is less caged. You have more flow. You have more flow, and you also have it's more versatile as well. So this can potentially translate into better outcomes. So when we first used BioAdaptor in our hospital, at that time there was no clinical data at all. So we decided to embark on a registry. So we're happy to share some of our results. So we started using DynamX BioAdaptor in 2021, and we used it in 54 patients. Mean age was about 57.1, predominantly male, and slightly more in the inferior MR. And most of the patients, I would say, are less complex. The single vessel accounts for about 50% of our patients, and we did it mostly transradial. So in terms of cardiovascular risk factors, diabetes prevalence was not too high, 17%. And we used quite a fair bit of intraoperative imaging during the primary PCI, so mainly IRIS. For patients with heavy thrombus, we used the penumbra, and we also used quite a fair bit of 2B3s, mainly by boluses. So number of stents 1.1, mean stent diameter was 3.16, and total stent length was about 29.5. So for our first 54 patients, basically very good outcomes. You can see that we have no events at all at 30 days and no events at 12 months. Similarly for stent thrombosis. I think the best way to show the clinical use of this stent is by showing cases. So we did share our results in the DCTAP last year as an abstract. So I just want to show a few cases of how we use BioAdaptor in primary PCI. So this is an anterior STEMI. So after we establish low diffuse disease, so we perform IRIS and we implant a 3538 BioAdaptor. So this is the final result. So patient was recruited into a study that requires CT angio. So you can see that CT angio at 12 months, the BioAdaptor was widely patent. So second case was an inferior MR patient with a occluded mid-RCA. So again, we perform IRIS and then we deliver the stent. So when you do a proper lesion prep, it's quite easy to deliver the BioAdaptor. So you plot the scan and that is the final result. So patient came back with atypical chest pain, and then we did a restudy angio to show that the BioAdaptor was correctly plated. So as we grew in confidence, we started using in more complex patients. This is a 64-year-old patient with anterior STEMI. You can appreciate some calcium in the mid-LAD. So I just show a 360 ring of calcium. So we decided to do a shockwave to crack the calcified plaque. So successful cracking with luminal gain. And then we implant the DynamX trio to the mold. So again, we used it last year in a patient, quite a young patient who was playing soccer and then developed a cardiac arrest and VTDF. And when we established flow, there's a very tight cross LED stenosis. After thrombosuction, you can see some residual stenosis. So it was not clear what was the exact mechanism of ACS, so the guidelines would recommend you to do an intracoronary imaging. And in this case, we choose to use the OCT. And from the OCT, you can see that there are evidence of clot and probably he had a plaque rupture. So patient being a young patient, I thought that probably the DynamX BioAdaptor was the best choice for him. So we implanted the DynamX and we does the how to stem site with the OCT, and patients survived the EMI episode. So from our preliminary experience, I think the DynamX BioAdaptor is safe and feasible. I think because we choose relatively lower risk of STEMI patients, that would have accounted for the favorable results, and we always need a large RCT. So I think you have heard from Paul about the Infinity Suite Hub. This is a large trial involving 2,400 patients. And one thing that I want to highlight is they have a high proportion of ACS patients, about 77%, and STEMI accounts for 23.5%. So I think you can see that the primary outcome is similar at 12 months, but with secondary endpoint, when you see the benefit after 6 months in plateauing of events. So I think this is my last slide. So just going to again highlight the point that you currently have 2 RCTs showing the plateauing of events after 6 months. So I would say that the results are pretty impressive. Thank you very much for your kind attention.
So we have heard about the Singapore experience. Now, may I introduce the next speaker,